Do you wake up tired or feel foggy during the day or struggle to stay asleep at night? Those could be signs of sleep apnea. And two local dentists are sharing what you need to watch for and how an oral appliance could be an option for some sleep apnea patients.
I'm Mark Jerome. I'm a general dentist.
And I'm Brian Osterday, also a general dentist. I work at Sleep Apnea Solutions of Cincinnati.
Sleep apnea is a disturbance in your breathing while you're trying to sleep at night. So something is closing off your airway so many times per hour, creating a loss of oxygen to your brain and to the rest of your body.
Lots of different things can lead to a diagnosis of sleep apnea. Excessive daytime sleepiness, brain fog, gasping for breath when you're just trying to sleep. If you have any of those symptoms or any other symptoms as well that you think could be troublesome, it's best to see your physician and probably get a sleep study to see if you do have sleep apnea.
Maybe they've seen a sleep physician and they've tried CPAP and they're looking for a different alternative to treat their sleep apnea.
CPAP is the gold standard of treating sleep apnea. That being said, a large percentage of patients either can't or won't wear a CPAP for one reason or another, and that's where we come in. We manufacture sleep apnea appliances that are oral appliances that help to protrude the jaw forward slightly, down and forward just a bit to open the airway, and that's how it works. If the jaw is protruded forward, it opens the airway, allows them to have a simpler, easier way to breathe.
In our office, it starts with a free consultation. Patients come in, and during that initial assessment, we'll do a clinical exam to check their airway, to see if they do have any structures that are blocking their ability to breathe through their mouth. We'll also do a question and answer session to find out some more information about the symptoms and problems they may be having related to sleep apnea. We'll also do an airway test of their oral airway and their nasal airway through acoustic pharyngometry and rhinometry, which basically gives us an idea if they're actually a good candidate for an oral sleep appliance.
There are probably a couple hundred FDA-approved oral appliances. That being said, the assessments that we do, we are able to understand which one might work best with patients. We have personally selected a series of them that we feel to be most appropriate, that we feel we get the best results at treating patients with. And we try our best to accommodate each patient specifically with one that we feel would be in their best situation. Both Mark and I are diplomats of the American Board of Dental Sleep Medicine. It is a rigorous testing process that we've done and passed the board exam through the American Board of Dental Sleep Medicine to be able to provide the top level treatment for patients that are seeking an oral appliance for sleep apnea care.
I've been a general dentist for 30 years, seen a lot of patients through the years who I felt like where I could see their health decline, I could see other things going on outside of the dental aspects. And about 7 years ago, I had a patient in my general practice who I could tell he was declining and having issues, but he just wouldn't seek help. And I tried to encourage him to go see a sleep physician because I had a good hunch that he had sleep apnea. He just wouldn't, he was dragging his feet, just wouldn't do it. And I was out of the office one day and got a call from my office manager to tell me that she just found out that he had passed away in his sleep. So that was pretty discouraging, and I was pretty upset about that, and at that point just decided that I needed to do more. That's when actually I reached out to Brian to see if he'd be interested in starting a practice like this, like Sleep Apnea Solutions of Cincinnati, so that we could help as many people as we could. I'm proud to say we've helped a lot of people.
The youngest patient that I've had in here was a 23-year-old female that was maybe 100 pounds that had moderate sleep apnea that we were able to help. It's not just something where it's the older, overweight population like some people might think it is.
So if you've had a sleep study, especially if you're a mild to moderate apnea patient, come see us at Sleep Apnea Solutions in Cincinnati.